As a healthcare worker, you are responsible for protecting the health and safety of all those you care for, as well as your coworkers and yourself. You may come in contact with microorganisms that can cause infectious diseases at any time, and infection control skills will help prevent spreading these microorganisms to you or others. Infections are caused by microorganisms that may be in the air or on any surface that you touch, including the human body. The most important single skill you can develop to prevent and control the spread of infections is the practice of good, routine hand hygiene. Hands should be decontaminated at these appropriate times: when coming on duty, before and after caring for each individual, between tasks and procedures on the same person to prevent cross-contamination of different body sites, before and after using protective gloves, after personal toileting or wiping your nose, before and after eating, whenever your hands are obviously soiled, and before leaving the home. In most cases, the CDC recommends that hand decontamination be performed using an alcohol-based hand rub. This has been shown to be more effective against microbes and quicker and easier to perform, thus encouraging greater adherence to hand hygiene. The manufacturer's recommended amount of the agent should be applied to the palm of one hand. Then the hands should be rubbed together so the agent covers all surfaces of the hands and fingers. Rub until the hands are dry and do not rinse. At the start of a shift, when hands are visibly soiled or when there's a buildup of alcohol product, hands should be washed with soap and water. To wash your hands, you will need plain soap or detergent, paper towels, warm running water, and a waste paper basket. Antimicrobial soap may be required in some cases, such as when caring for people with suppressed immune systems. Begin the procedure by turning on the water. Using warm water, completely wet your hands and wrists without touching the sink. Keep your fingers pointed downward and stand back from the sink to avoid contaminating your clothing. Apply the detergent or soap and work up a lather. Keeping your hands lower than your elbows, work the soap over every area of your hands and wrists. Wash 2 inches above your wrists. Clean between your fingers by interlacing them and rubbing. If you wear a wedding band, be sure to rub underneath it. Be sure to get under your nails by rubbing the tips of your fingers against your palms, creating friction around the nail beds. Keeping your fingertips down, rinse from above your wrists down to your fingers. Then dry your hands thoroughly using paper towels. To avoid contamination, use a paper towel to turn off the water. Never touch the faucet after washing your hands. Discard the paper towels. Thorough hand washing is the single most important skill habit you can develop to help prevent the spread of infections. Another important skill is proper linen handling. The proper handling of clean and soiled linen is an important way to prevent the spread of infection. First, perform hand hygiene before handling clean linen. Clean linen should be stored only in areas designated for clean linen. When obtaining clean linen, take only the necessary items, because linen taken into the room cannot be returned to the storage area. Hold the linen away from your body, because your clothing is considered contaminated. Soiled linen may be contaminated and should be handled as little as possible. To prevent airborne contamination, do not shake linens or fluff them in the air. Never place them on the floor, over bed table, or on a chair. Keep soiled linens away from your uniform. Soiled linen must be placed in a covered container. Make sure the container can be closed tightly to prevent airborne contamination and to reduce odor. Any linen that falls to the floor is considered contaminated and may not be used. Wear protective gloves if blood or body fluids, secretions, or excretions, except sweat, are present on the linens. Prevent skin and clothing contact by holding linens away from the body. A gown should be worn if contact cannot be avoided. Linen contaminated with blood or other body fluids, secretions, or excretions, including urine or feces, must be placed in a plastic bag that is leak-proof and will prevent soak-through. A cloth laundry bag does not prevent soak-through, but the plastic bag containing wet items may be placed inside it for transport to the laundry facility. When contact isolation precautions have been ordered, all linens must be treated as infectious and safely stored according to the policy of your facility. Finally, perform hand hygiene after handling any soiled linen, even if gloves were worn. Proper linen handling will help prevent the spread of infection to you, other patients, or anyone who might contact the linen. Another important skill is knowing how to use protective gloves. The appropriate use of protective gloves is essential to prevent the spread of infection. You must know when to wear them and how to put them on and take them off safely. Standard precautions call for the wearing of protective gloves whenever there is a risk of contacting blood, body fluids, secretions, or excretions except sweat, non-intact skin, or mucous membranes. In addition, gloves and/or other protective equipment may be needed when transmission-based isolation precautions have been ordered. Check with your supervisor. If you have open lesions or breaks in the skin of your hands that could allow microorganisms to get into your body, check with your supervisor to determine if you should provide care. If you do provide care, gloves should be worn. Just as important as knowing when to wear gloves is knowing how to put them on and take them off safely. Before putting them on, be sure to perform hand hygiene. After performing hand hygiene, obtain the protective gloves. Carefully put your hands into the gloves. Be sure to pull the cuffs up over your wrists. Then carefully examine the gloves to make sure there are no holes or cracks. To avoid offending some patients, you may need to explain why you are wearing gloves. Follow the procedures in effect in your facility. After using the gloves, remove them by grasping the outside of the first glove at the cuff and pulling it off inside out. Then, without touching the outside of the glove with your bare hand, pull the second glove inside out over the first glove. Discard gloves according to your facility's policy. Be sure to perform hand hygiene after wearing gloves. Gloves are one important form of personal protective equipment, but there are other forms. In some instances, additional personal protective equipment is necessary to prevent the spread of infection. For example, standard precautions require that a face mask, protective eyewear, and a gown be worn when there is a risk of blood or other body fluids, secretions, or excretions splashing on your face or contaminating your clothing. A type N95 respirator is required when airborne precautions have been ordered, such as for tuberculosis. Always perform hand hygiene before putting on personal protective equipment. Face masks and eyewear protect the mucous membranes of your eyes, nose, and mouth whenever there is a chance that blood, body fluids, secretions, or excretions will splash, splatter, or spray. Face masks become ineffective when they get wet, unless they are specifically designed to function when wet. A gown may be used to protect your clothing. Unfold the gown so the opening is at the back. Put your arms into the sleeves of the gown and fit the gown at the neck, making sure that your uniform is covered. Reach behind and fasten the adhesive strip. If the gown has ties, tie a simple shoelace bow. Grasp the edges of the gown and pull to the back. Overlap the edges and roll them together in the back, closing the opening and covering your uniform completely. Tie a bow at the waist or fasten the adhesive strip. Gloves must extend over the cuff of the gown. After using the protective gown, unfasten the waist and loosen the gown. Then remove your protective gloves and discard them. If the gloves are heavily soiled, remove them first. Open the neck of the gown. The neck fasteners are considered clean. Remove the gown by rolling it away from yourself into a ball. Roll it with the contaminated portion inside. If the gown was used where special contact precautions have been ordered, it should be discarded inside the room. Then remove the mask. If large amounts of blood or infectious material are on the gown, remove the gown with your gloves on. Remove the gloves after the gown has been disposed of and before removing your mask. Respiratory protection, such as a type N95 respirator, is needed when airborne precautions are required, such as when entering the room of someone with tuberculosis. Face masks only protect against splashes and cannot provide adequate respiratory protection. Make sure the respirator makes a complete seal around the face so that unfiltered air that could be contaminated is kept out. Finally, remember to perform hand hygiene after giving care. Personal protective equipment forms a barrier between you and potentially infectious material. One form of infectious material that will need particular care is a blood spill. Since blood may contain the hepatitis B or C virus, or the virus that causes AIDS, blood spills must be cleaned up quickly in order to prevent the spread of these infections. To clean a blood spill, you will need protective gloves, a red plastic bag, paper towels, disinfectant spray, and a wet floor warning sign. Wearing protective gloves, use the paper towels to wipe up the blood. Dispose of the towels in the red plastic bag, being careful not to contaminate the outside of the bag. Spray the area with the disinfectant until it is glistening wet. A solution of 1 part bleach to 10 parts water is an effective disinfectant spray. For complete disinfection, allow the area to air dry. Remove the gloves and place them in the bag. Again, be careful not to contaminate the outside of the bag. Then tie off the bag and discard it according to your facility's policies. Finally, be sure to perform hand hygiene when you are finished. Since you must presume all blood is infectious, it is important to follow the procedures for handling blood carefully. You must also follow your facility's safety procedures for handling infectious waste. Disposable items soiled with blood, body fluids, or secretions or excretions should be considered potentially infectious and handled in a way that prevents skin and mucous membrane contact and contamination of clothing. Waste that is dripping or that oozes when pressure is applied is placed in a leak-proof plastic bag colored red to clearly indicate infectious waste. Be careful not to touch the outside of the bag with the waste. Gloves should be worn if there is danger of skin contact with the infectious waste. Tie the red bag securely. Then place the bag into the contaminated waste container or the locked area designated for infectious waste. The infectious waste is disposed of according to the policy of your facility. If the outside of the bag containing infectious waste or infectious linens becomes contaminated, punctured, or torn, it must be double bagged. First, tie off the red bag in which the infectious waste has been deposited. Then carefully place it inside a clean red bag. Be careful not to touch the outside of the clean bag with the bag of infectious waste. To prevent transmission of infection by puncture wounds, used sharps, such as needles or razors, must be discarded in puncture-resistant containers and handled as hazardous waste. Finally, as with all infection control procedures, remember to perform hand hygiene after handling infectious waste, even if gloves were worn. By following infection control procedures, you can safely provide care and you can help protect yourself and others from infection.